Hey guys, Jeremy West here with J.A.O Medical Consultants. We're here today doing a case study called the IPA and the withhold, and we're going to show you how we saved the client $375,000 in fiscal year 2018. Yes, that's a real number, and I love using this example of what J.A.O does, how we do it, and how we partner with practices to save them a boatload of money. So our mission is simple. We're here to help private practices maximize profits. We do this by optimizing billing, reducing expenses, and improving patient satisfaction. We have a number of methods to do this, everything from marketing to financial analysis and operational considerations. But I came up in private practice, so it is so important to me to work in this space and to help docs that are business owners, and it's getting harder and harder as margins get smaller to stay private. So that's why I love what I do, and I love working in the space. So my expertise is in practice management, medical billing and coding, finance, marketing, business consulting. I really love using technology. I think it's so important. Healthcare is so far behind on technology in relation to other industries, and we leverage it. We want to streamline your operations by doing that. My professional experience, most recently, I was employed by Allergan. I was a reimbursement representative over there, working on Botox therapeutic. So working with neurology, pain management, physiatry, any providers that were injecting Botox into their patients. Before that, I was running the Neurology Center of New England over in Foxborough, Massachusetts. They're a great group, doing a lot in the neurology space. I stay up to date with what they're doing, and they're a great organization. Fallon Community Health Plan, where I got my insurance experience. Fallon is a payer that sort of specializes in managed Medicaid, managed Medicare. They had a dual eligible SCO program and a PACE program, and they also had commercial lines of business. My role there was in provider relations and was the liaison between the plan and the PBM, which was CVS Caremark, and also any of the provider organizations, PHOs, IPAs, and practices doing business with the health plan. I, really pride myself on having an atypical and unique experience in healthcare. Most people kind of pick a sector and they work there, and they have that lens, and I had the opportunity and the luxury to work in pharma, insurance, and practice management. So I see things a lot differently, and I see things from many different angles, which I think benefits what I do, and it benefits the clients we work with. So let's get into the case study here. And the scenario was we had a private practice that was contracted through a local IPA. They had historically had withholds with a number of payers, but in the past, the IPA would return the monies that were withheld in bonus checks. So at the end of the year, if one of the practices that were participating in that IPA met all their performance metrics, which consisted of HEDIS measures and following up and going to certain meetings. They were really simple measures that they had to meet, and the practice got a check for any money that was withheld in the previous year. The problem was the IPA provisions in that contract were amended in fiscal year 2018, specifically to the local Blue Cross plan. So now the money that was being withheld was not getting returned based on performance metrics. The idea that the health system had was that money was going to go to beefing up the primary care network, which the thought was would increase the volume of patients coming to the specialists if more PCPs were in the network. Nothing nefarious, just the health system trying to leverage whatever they could to increase the patients that they were taking care of. So what is an IPA? An IPA is an independent practice association. This is an organization really established to contract with third party payers. What they do is they bring physicians and groups that would otherwise not have any corporate or legal relationship, and they constitute themselves as a group, and it's for leverage in contracting. The idea is if there are many practices under the umbrella of the IPA, they have a lot more leverage to go to the payers and negotiate better rates because they're controlling more lives of the payer members. IPAs provide services to managed care organizations and typically get paid on a per capita flat retainer fee or a negotiated fee for service basis. What is a withhold? So a withhold is just an amount deducted from payment to a physician or group. That amount may or may not be returned, and it depends on the contract that the practice has with their organization. It just leads me to believe that knowing your contracts and really having someone at your practice be honed in on that is so important because things change and you have to stay viable going forward. It's a tough business to stay in and to keep above water. So withholds are just a long-standing type of risk arrangement. Plans and ACOs and IPAs have lots of different ways to manage risk, and it's the plan's way of holding the ACOs and the IPAs accountable for the outcomes of their members. There's a broad range of reimbursement methodologies. We won't get into the nitty gritty of value-based care and all the buzzwords that are thrown around nowadays. But again, it's just so crucial to understand what your contracts are, the provisions in them, and what you're going to do to address any needs on an ongoing basis. So to get back to the practice, what did this change mean for them? Basically, it meant that a percentage of each claim line for all Blue Cross Blue Shield members in that state were now going to the IPA. Most of these withhold amounts were so marginal that it didn't really go noticed at all. An example is on a $200 claim, 8% withhold meant that $16 was going to the IPA and $184 was going to the provider. Not really a big deal in the grand scheme of things. The problem here was that this particular practice offered infusion services and were buying and billing high-cost biologics. So that same 8% withhold on a $35,000 buy and bill drug would mean a withhold of $2,800. That is much different than $16. And for an office that's doing a high volume of infusions, these numbers got high in a hurry. How in the world did this go unnoticed? Like so many other medical practices, they outsource their billing. The staff in the practice and the manager is wearing 5 hats and doing a million things. And they didn't really have someone dedicated to running reports and monitoring claim data. So the practice was just, seeing money hit the bank account and wasn't seeing claim denials, so they weren't really asking questions. The volume of J-code claims was just so small that, it was hard to pinpoint. Only 9% of total claims for the whole year of 2018 had a J-code. Only 4.5% of those claims were Blue Cross claims with a J-code. So to put it into perspective, almost 14,000 total claims and 640 were affected by the withhold with Blue Cross. How do we identify this? So what J.A.O. does is we do a reimbursement analysis for any prospective clients. We do this as a way to show our value in the front end. We want to make sure that you see that we're experts and that we're going to save you money. What we did here was this client was on ECW, which is notoriously bad at analytics and reporting. So we export everything in the Microsoft Excel. Just allows us to filter and sort things and chop it up in a meaningful way. And we go through these reports with a fine-tooth comb. We honed in on J codes by noticing there were large amounts in the withhold column there, you see highlighted in yellow, and we sorted it in a way that was descending. So the highest value is at the top of the spreadsheet and it went down to the lowest value. So we were quickly able to see that there were huge dollar amounts and that Blue Cross was the culprit, which raised all sorts of red flags and caused us to go back to the provider and have a conversation about what we found. Obviously, they weren't happy to see this huge dollar amount. Never an easy conversation, but we just had to consider, what are we going to do about it? How are we going to address this? So what we suggested we do was we got information together and we helped the provider approach the IPA. And the IPA, we were just hopeful that they weren't out to get us or anything. They didn't want to crush this practice. So we pushed and we got up all the way to the CMO, and eventually they agreed to pay the practice back on all the J code withholds for Blue Cross Blue Shield because they saw that this practice was getting crushed and they weren't going to be able to continue doing infusion at this rate. So, the way that they were going to treat their patients would be affected. Ultimately, the IPA agreed that every 6 months we would run reports and see what that withhold amount on J codes was, and they would cut a check to the practice, which was a huge win for them. So the end result, the reports we ran out of their EHR from our reimbursement analysis totaled up a withhold of about $375,000 in fiscal year 2018. It was actually a tick higher. The practice now receives checks in full for those J code withholds every 6 months. And infusion services now is really their main driver of revenue. And they're running a great program over there, and we ironed out some of the issues that were plaguing them. So I'm going to wrap up here and just say that JAO Medical, we pride ourselves on bringing value to our clients. We always do a free analysis on the claim side and reimbursement as well as financial if that's the need. And we look at the data and figure out where you're inefficient, where you're losing money, where you can do better. If you're interested in talking with us and getting a free consultation, all you got to do is visit our website. It's www.jaomedical.com/contact. There you'll see a form and you put your information there and it sends all the info over to us, and then it will take you to an automated scheduler. All you got to do is put a time on our schedule that's convenient for you, and we'll get on the phone and we'll talk about your business and we'll see how we can help you. So I just want to thank you for taking the time to watch this video. Again, please feel free to contact us with any questions. You can do that through our website, or feel free to reach out to me directly. My name is Jeremy West. I am the founder and managing director of J.A.O Medical Consultants. My email is jeremy.west@jaomedical.com, and I'd love to talk with you and see what we can do to help you. Thanks so much.